Now we'll move on to our next set of speakers. Again, very, very excited to hear from two members of our Committee for Advancement of Respite Research to talk about philanthropy's role in advancing a respite research agenda that addresses the diverse needs of family caregivers. If you go to the next slide, please, you will see our presenters listed here. We have Rani Snyder, who is the Vice President of the programs for the John A. Hartford Foundation, and Ken Genewick, who is the Vice President of Programs at the Health Foundation for Western and Central New York. So we are going to start, I believe, with a presentation from Rani. So I'm going to pass it off to Rani, and you can move to the next slide. And we are really excited to have you here today, Rani, to share more about the work that you're doing at the foundation.
Thank you, Kim. I'm really happy to be here. And gosh, there's a lot of rich discussion that's already happened as a part of, for example, the last panel or presentation rather that you gave that I just think is so critical and needs to be threaded through everything that we're talking about and everything that we're doing. So thank you to you and everyone who is participating here today. So as Kim said, I'm Rani Snyder. I'm the Vice President for Program at the John A. Hartford Foundation. And I'll tell you a little bit about our foundation. If we go to the next slide, please. We are a private foundation. So we happen to be based in New York City, but we operate nationally. And we were established by the family owners of the great Atlantic and Pacific Tea Company, or you may be more familiar with it as the A&P grocery chain, in the late 1920s. So we have a long history, a rich history. And I will say that because what we do now is completely devoted to caring for older adults. As of March of this year, we have contributed about $724 million to projects that improve the care of older adults. Next slide, please. All right, so this is just going to tell you a little bit about how we got here, how we got to the point that we are funding older adults as our topic. And this has been the guiding philosophy of the John A. Hartford Foundation ever since its establishment in 1929. It is to carve out that as we say, the one band, one small band, where we know that we can make a difference. Because we are, as I said, only a mid-sized foundation, yet we operate nationally. So we want to really focus in on not everything that's important everywhere, because there's so many great causes, but really on an area where we can make a significant contribution. And that is very much how we think about the work that we do. Historically, our work and our expertise has been in the area of health and healthcare. And since 1982, we've focused on aging. So since we went to focusing solely on aging somewhere kind of in the mid-90s, but we have been in this area for a long time, and therefore our expertise, our connections, the field that we have to the best of our ability helped to grow is really all around geriatrics, gerontology, and supporting older adults in their health and healthcare. Next slide, please. So a little bit about how we focus that now. I mentioned that our mission is to improve the care of older adults. We get at that mission through these three priority areas. First is building age-friendly health systems. Second is supporting family caregivers. And third is improving serious illness and end-of-life care. And, you know, you don't have to see this Venn diagram to understand that those are really overlapping areas. In fact, since we would consider much of the respite work that we're talking about here today to go in that family caregiving area. But if you look at it and think of who is respite for, both the people receiving it and the caregivers who are benefiting from that, it is oftentimes for people who may be older and or who have serious illness. It's not strictly for end of life, but it certainly can be, particularly as we think about it for conditions like dementia, which is one of the fairly stressful conditions where we see a lot of need for support for caregivers and for respite in particular. One other hallmark of the way that we work, because I mentioned we've been in the area of aging for a very long time, is that we have tried in every way possible to be field building. And what that means is that we have to know the field. So having said that, we have a pretty small staff. Again, we are a mid-sized foundation, but we have our entire staff, including, the finance folks and the folks who aren't just our program staff, is only about 18 people. And so that includes our president, myself, as the number two, and 4 or 5 program officer level folks. But to know the field in an area like this, we have to be out there in it. We have to be mixing with people. We have to be interacting with everyone that we can to build our perspectives from multiple communities. And so I'll tell you a little bit more about that as we go. Next slide, please. So I referenced our program team and the 3 sort of interconnected, overlapping areas that you see, these concentric circles. The ways that we familiarize ourselves with the field, I will outline in this and then also the next slide. So here, we're constantly exploring, we're refining our knowledge, we're refining the areas that we are familiar with to bring those back to the foundation. And we rely on lots of folks very much like you to inform us and to help keep us sort of honest and up to date. We use these 3 program priority areas to frame the approach that we use to get at the work, and we very much have a health focus. Next slide, please. So we were asked to talk a little bit, my colleague Ken, who will come behind me, about sort of how and why we fund the way we do. And one of the things that researchers like yourselves often find helpful is understanding how in different organizations one can get to particular funding. We don't fund research directly at the John A. Hartford Foundation, but we certainly do use it and we do embed it in many of our projects. So we may not have a big research project, but there frequently is a strand that is very much about research within our grants. So additional sources of knowing, if you will, for us include, I've referenced a little bit, this sort of staff knowledge and networking, various meetings in the field. I actually missed the last 2 days of this ARCH meeting because I was out giving presentations and talking to people and meeting people in the public health space, which historically has not been focused on aging, despite the fact that longevity is one of the greatest achievements of public health, among other things. And yet they focus very much on maternal health and childhood health and vaccines, but much less so on how we keep our older adults healthy in the public health space. So that was the meeting in the field example. Our board, we have board members who are incredibly engaged and curious, and they don't operate in the space the way that the staff does every day, but they ask really very engaged questions, really probing questions that prompt us to go back and learn more and come back to them as well. And there's the standard ways that I think all of us kind of scan all the time. We're reading academic journal articles for sure. And again, that's where some of your research comes in. And we're looking at the news because we want to see not just what is happening, let's say, in research right now, but what's coming down the pike. And that's a really good way to get a scan on the field and the fields that are related. Universities, we're always talking with and working with folks who are, and probably many of you as researchers are yourselves at universities, but we also are always working with folks who are in a variety of settings, not just as researchers, but as clinicians and others in the universities. And then, of course, there are the professional societies where so many people go to get their information, particular to their discipline or their field. Trade organizations, we also tend to learn a lot through our own current grants because those grantees, every one of us has our own network, right? And the beauty of our society when we're doing it right is building on each other's networks, is understanding them and incorporating them and bringing in folks who who I don't, and vice versa, for example. So we learn a lot through our own grantees. And then, of course, there's the need for person-centered care, for person-centered research. We just heard it in the last Kim's session, and as well as some of the great conversation and questions that came after. So that includes, for us, older adults, since that's where we're focused, and the people and the individual patients and caregivers who we serve. And then we have a lot of partnerships. So very much of the work that we do is built on partnerships, and that includes also a lot of our federal colleagues. So I know that the Arch work is funded through the Administration for Community Living, for example, and we work with them a lot. We also work with many of the other federal agencies, CDC. Now I've got them on my brain because I was at a public health meeting for the last few days, but CMS and CMMI, and I'll talk about that in a couple minutes as well. These are all different ways that we gain information and resources and bring them to our work. Next slide, please. So we have to make a lot of judgments, again, because we are not in a position to fund all of the amazing things that are happening in the field. And so we really have to, it's back to that narrow band, that one small band that I referenced in our approach. We make judgments that are related to all of these things. Different settings of care, because we are very care-based, that's our history in the medical and health field. Different models of care, because we have a long-term history of building models over time. We're always thinking about scalability and sustainability. And this all comes back also to the field building that I referenced earlier on. And then, we operate in ways that are really very much about taking advantage of the opportunities. So we think very much about the opportunities, not only where we are, but where we want to be headed. And of course, you can't think about opportunities without thinking about the gaps, because we don't want to be recreating anyone's work. We want to be integrating work everywhere possible. And we want to do that in the long term. Next slide, please. Okay, so this actually comes from a board meeting that we had a couple of years back. Well, look at that, pre-COVID. So it's like worlds ago. But we think about the ways, and this is how we talk to our own trustees. It's how we very much think about the sort of the how of what we do. And we do that by approaching the issues from a variety, a multiple of reinforcing angles. So for example, we think about clinical angles, advocacy angles, policy angles, research, making sure that research informs what we are doing, and regulatory as well. So those are a variety of the ways that we may push on a single issue from all different sides. And caregiving and respite is a good example for that. Next, building demand from multiple stakeholders. Now, I already mentioned academic research, clinical, public policy, and the public themselves, which is, a longer range goal because it can be harder. It's a less targeted audience, right? It's very broad. But within respite as well, we were just talking about different terms and what they mean to different people in different cultures and languages. That's really important work. It's just not easy work. And then we really think about helping some of the federal agencies through partnerships and thought leadership. And I'm going to tell you a little bit more about that's respite specific about some of the ACL work that we are sort of hand in hand, public-private partnership working on. And so that includes a variety of the federal entities I already mentioned, CMS and CMMI. I didn't mention HRSA yet. They have funded that's the federal agency that does workforce training. And they have funded a set of, I'll get the number wrong because it's changed over time, but I'm going to say about 48 different grants all across the country that they call geriatrics workforce enhancement programs. And they are to get better care for older adults in communities through primary care. It includes dementia care, which again, there's a lot of need for respite work there. And so I also mentioned ACL and the CDC. We want all of them to learn that they can rely on us for partnerships and thought leadership, just as we rely on them. Next is ensuring that our various program grants inform each other. So for example, using crosswalks, bringing one grantee into another's work. It's back to those concentric circles. It really is everywhere we can, integrating the work, coordinating, and bringing in partners and partnerships to that work as well. So that what we're doing overall is, rather than creating a bunch of silos in various places, is building strength to get to that, for us, that mission of improving care for older adults. But it's very much about tying things together for a stronger base. Using a multi-tiered communications approach. This is something that we have changed over time. We started out really just publicizing things that our grantees did. But we've realized over time that we needed to get beyond that, that we need to raise the visibility of the mission to get to that, and that that's not just policy through, say, a journal like Health Affairs, or broader public support through, say, Next Avenue, which is a publication for older adults that is through NPR sources, not just through health systems such as modern healthcare, but over time, over a mix of many of those. And then using our longstanding community to help accelerate the changes that we would like to see. Next slide, please. All right. So this research summit itself shows how all of the work, the evaluation and the research is so important to philanthropy, and the ability really to fund other services as well. So, we think about this in terms of the evaluation and research, as well as doing more rigorous evaluations to inspire researchers to look at, for example, with Respite as a model. And then finally, our foundation is focused more in moving models, because as I mentioned, that sort of historically is part of the work that we've always done and a little bit less in research. But we absolutely know and recognize that having the research is what's important to determine which programs and models are working and what should be implemented. And that's what I meant earlier when I said, there's often a research element or strand built in through the work that we fund in larger ways. So we do focus on health equity, and having this research and evaluation information that is already grounded in health equity is super important to help us to fund our most meaningful projects. So in the next few slides, next slide, please. I'm going to talk a little bit about several of the John A. Hartford Foundation funded projects that you may or may not have heard of. And this first one is where we have funded the National Academy for State Health Policy, and they do respite work as part of a larger initiative. So the work that we have funded is to support and foster state and national efforts to increase access to respite for family caregivers through these 4 bullets. So developing, testing, and scaling a respite workforce with recruitment, training, and retention programming. Hosting, part of the grant has hosted a respite summit to disseminate state best practices for increasing respite service access. That is in conjunction with ARCH, so perhaps some of you are already there. I hope so. Facilitating a federal-state dialogue to implement respite actions within the national strategy to support family caregivers. That national strategy is very much what the NASHP grant was started to do. And then this is sort of the communication side of things, conducting state scans on respite and direct care workforce policy activity and featuring those in case studies, suggesting promising practices for other states in this case, because NASHP is a state-based organization, and the federal entities are doing some of this work on the federal level. And then we are thinking more and more about how to get into communities with some of this work, because it sort of started at the federal level. We're bringing it to the states, and it's got to get all the way down to communities, because that's where the action is, right? I mean, that's where we're seeing all of the need happen. Next slide, please. All right. So this is another program that we have funded. It's called Best Programs for Caregiving. So let's see. We have funded this program. Again, this is a national program. It's an online resource for organizations to be able to select existing evidence-based dementia caregiving programs to determine what to implement in their areas. There are over 40 different programs of these evidence-based, but there's many, many more than 40 programs. But with those that really have the evidence base, and again, this is based in the research, there are at least, I think, 44 plus now that are listed, and it's searchable by different populations, by availability, whether you need it to be telephonic, whether it can work with health systems, for example. And this has been done in collaboration with the Benjamin Rose Institute on Aging and the Family Caregiver Alliance. So there's been a great deal of research done as a part of this work. And there is a brand new consumer version. So it's not just now for organizations to search, but also for individuals in communities. We found that people were starting to find it and use it to look for things like respite services. And so now we've added a consumer sort of side where there's a zip code finder that can focus on where you can find some of these programs that can serve the kinds of populations that you need. This is specific to dementia, as I mentioned. And, we've been funding this work because of the quality of the research that the Benjamin Rose Institute does. And we have included a partnership as part of this work with the Diverse Elders Coalition to make sure that we and they, throughout this whole process, are paying sufficient attention to the needs of diverse populations as well. So, and you can see down here on the lower right, the link to get there. Next slide, please. This is also about the best programs for caregiving. I trip on that name because it was best practices for caregiving initially, and then we changed it when we brought out the consumer version, and now I just trip over my tongue. The whole point of this grant, though, was to establish a one-stop, comprehensive place where people could get this information for free so that we could get this work out in communities to the folks who need it. And you can see here the approach that we have taken to create it, to emphasize the programs where we know that there is evidence and for a variety of communities, and then to really think about the ways to make this as sustainable as possible. Okay, next slide, please. Okay. So in addition to funding some of the work through RAISE, we have also, through NASHP to support the RAISE Family Caregivers Act and their advisory council, and then ultimately the first of its kind ever national strategy. I mentioned earlier that we sort of press on things from all sides as one of the ways that we get at our work. We then later funded a national campaign, which we see as action towards the implementation of this big, huge, vast national strategy. So we funded the National Alliance for Caregiving, NAC, to catalyze policy action and federal level coordination. So we want to make sure in the best way possible and in conjunction with our partners at the Administration for Community Living to kind of keep the pressure on the federal entities to make sure that they know that we're watching, that we want to push in every possible way for action. And these 3 bullets really speak to some of the ways that we are getting at that so far. Engaging caregiver and patient advocacy groups and health systems and state level coalitions as well, tracking the implementation of the progress on the recommendations that came out in that big, broad strategy. There were like over 350 federal actions, and then federal entities added another 40 something more. So we're at almost 400 federal actions, but there are additional over 150 that are for states and religious organizations and philanthropy and in communities. And then educating federal and state policymakers about the opportunities to better support caregivers. So this really is getting at the advocacy side, sort of in DC and in our states and in communities. Next slide, please. All right, so this is the second slide that's specific to that work, the NAC work around advocacy. So they had their first ever Caregiver Nation Summit in 2023. And that included 15 national organizations that are on the Alliance's steering committee. So they're bringing together not just themselves, but a whole host of advocates to push on this issue. And the goal of the campaign has been to educate and energize, educate and energize policymakers, because this is a nonpartisan issue. And we really are pushing on that fact for everyone, for all of the progress that all of us can make. And as I mentioned earlier, to track implementation progress on the national strategy, as well as advocating for federal and state policymakers about the need for increased funding for all of these efforts. That certainly includes Respite and the work that all of you are doing. We had that first ever meeting in Washington, D.C. Last October with advocates from 15 different states who came in. We held they held, but we were part of it, over 60 different congressional meetings. And the next summit of this kind will happen next month in DC again. Next slide, please. I just have a couple of slides left, but I cannot help talking about the fairly new, I don't know if this has come up before in the meeting, but the new guide model that CMMI and CMS have begun. This is a major step in recognizing the value of community-based services and respite care. We're really excited about this. And so the first sites, the established sites started July 1st of this year, and then a whole host, there are 390 sites total. The rest of them will start, they have 1 year to gear up if they haven't already been providing some of these services. And they have a year to start, to gear up and start next July. So we're very aware of the extent to which there are partnerships being built as required by the guide model in communities to do all kinds of community-based supports, and respite care is a part of this work. We know of certain specific AAA organizations that are guide participants themselves, and then the various sites are forming partnerships right now. We don't know how many, and there may be, at least one per site. There may be multiple partnerships per site. So I mentioned there are 390 of these, they're called participants by CMS, but guide sites basically. And each of those may have numerous participants, which means respite models all over the place, which means awesome opportunities for studying and learning and making sure that we get this right, so that there's payment for respite, so that there's widespread availability of respite. So if you go to the next slide, which is my last substantive slide, I just want to talk a little bit more about this guide model. If you look at number 4, the fourth bullet here, this is where respite services will be included as required at all 390 sites. Now, $2,500 per year is not a lot, and you might gasp when you see that and think about it. But boy, it's a lot better than nothing, and it's a really nice start to be able to build on with evidence. So CMS is paying model participants for these respite services, which are they define as temporary services provided to a beneficiary in their home, at an adult day center, or at a facility that can provide 24-hour care for the purpose of giving the caregiver temporary breaks from their caregiving responsibilities. I had a call earlier today with some of our colleagues at CMS and CMMI, and I told them that I would be speaking with you all today. And I said, this is an amazing opportunity to speak directly. And I understand that you've heard from someone at CMS as an earlier part of this conference. Nevertheless, I said, what are the needs that you have? Because we are dedicated to getting this guide model right so that we can roll it out, not just as a pilot program for those communities that happen to have it, but across the country for every one of us who are going to need it, for our parents, our grandparents, ourselves, our children someday. And here are the ideas that they shared back with me. They said that the questions on respite that would be helpful to us include: how is respite being delivered and utilized currently by caregivers for people living with dementia? And then, what preferences do caregivers and people with dementia have for receiving respite services? I mean, these are pretty basic questions, and yet they could be operationalized a number of ways, and I think they're really good fodder for research. Now, there are a couple of sub-questions buried within that: how is it being delivered, and that what preferences do caregivers and people with dementia have? And they include, what are, let's say, availability and use of hourly services versus a half a day or a full day service in home versus at an adult day center. Here's another kind of sub bullet, if you will. The use of home versus adult day center delivered services broadly. And another is, use and availability of overnight services. We certainly know that for people with dementia, and there are other conditions where this also applies, there can be a lot of interruptions, sleep interruptions, and overnights may be of value, but they're not easy, right? So the second question they sent me is, and we just touched on this in the last session, and I was kind of smiling to myself: is respite a familiar term to caregivers? And it literally came up as part of discussion. I saw it in the chat. It's not a question that's going to go away. It's a question that will continue to come up. And then the follow-up or the sub-bullet on that is, are there health literacy gaps that may make access and utilization challenging? And we know that there are, and I don't even know whether it should be called health literacy. I mean, some of it is just sort of that term could sound condescending, and I think it really is about awareness and not ignorance. I found these questions to be super helpful. I hope that overall this presentation is helpful to you. Next slide, please. Oh, I think I skipped one. I started talking and missed the last one, but there you go. You are most welcome to reach out to me, and I will stop there and hand it over to my friend and colleague, Ken, for his part. Oh, Kim, you're on mute.
Thank you so much, Rani. That was such a great overview of the important work that you're doing. And I posted in the chat, but I think really impressed at what the foundation is, I think, doing is striving for collective impact in the work that you do. And I wrote down community engaged funding, right? Like we talk about community engaged research, but you guys are really doing community engaged funding. You are listening to what the needs are, and it's just, I'm really impressed. So thank you for that great overview. I knew you're doing great things, but it's great to hear more details about that. So I'm going to, again, encourage everyone to post questions that they have for Rani in the chat. We will have time at the end for Q&A, but if there's a burning question you don't want to forget, feel free to post in the chat. She can monitor those. If there's something simple, she can respond in the chat, or we'll discuss those in the Q&A. But do you want to move us on to our next speaker? So if we could go to the next slide, I would like to welcome fellow CAR member Ken Genewick, who's going to share more about the great work he does in the Health Foundation for Western and Central New York. So Ken, I will turn it over to you.
Thank you, Kim. I appreciate it. Oh, there I am. I wasn't sure if I was going to see myself or not. So very nice to be here today, and as Kim mentioned, being a fellow CAR member, this has been pretty exciting to be here for the past 3 days, and I think like Rani, who I'm very happy to be presenting with today, said it best about smiling when she's hearing all this work, because I jotted down notes over the past 3 days that's really pertinent to the work that we do at our foundation, and particularly as it pertains to caregivers and respite. And as I heard the talk earlier about redefining what respite is, that it needs to be defined by the caregiver. I'm going to talk a little bit about some work that we're doing there, the need for equity in this work, and how different communities need different kinds of services and respite. Doris, I really loved your discussion around the term respite in the Latino community, and I think we're seeing that as well. Is just how is respite being talked about and described, and then also the talk about compensating those that we're working with, and I think we're finding that too, is how important it is to make sure that those we're working with and those stakeholders in the community, we're compensating and we're honoring them for their time. And so again, it's a pleasure to be here, and tough to follow Rani, but I'll do my best. So I want to talk to you and offer a more local and regional perspective in the way that our foundation does operate. I want to give you a little background on our foundation and the work that we do. I'm going to dig a little deep into our focus on and our intentional focus on equity, in throughout our foundation and the way our foundation operates, and then how we're bringing that into our work on with caregivers and with respite. Also want to tell you why that shapes why we're addressing the diverse needs of family caregivers. And then Rani talked a lot about it, but she kind of stole what I was thinking about too, is how important it is for us as a foundation to rely on and use the research that you all do, and then how we can in turn advance programs and robust evaluations that can hope to spur more research. So next slide, please. So the Health Foundation for Western and Central New York, we're a little over 20 years old. We were founded in 2002. We're a we're a health conversion foundation. So two health plans merged in New York State that impacted lives in two regions, in the Western New York and Central New York region. So you'll see that we serve 16 counties because that's where the impacted lives were for those. So our foundation was created with $100 million endowment that that now has grown over the years, and we now operate to serve these 16 counties with offices in the Buffalo and Syracuse areas, and we provide about over $5 million worth of funding in an annual basis into our community. So next slide, please. And we operate with the vision, as you see here, that a healthy Central and Western New York, where racial and social economic equity are prioritized so all people can reach their full potential and achieve equitable health outcomes. We have 3 midterm goals, and we also really have 3 focus areas in populations that we serve. Young children age 0 to 5 who are impacted by poverty, older adults living in the community and their caregivers, and then we focus on developing capacity for community-based organizations that serve them. And you'll see our 3 long-term goals here, but if we can advance to the next slide. Really, our strategies for pursuing our vision is through program development, and our program development, and we'll talk more about our programs as it pertains to caregivers, but for our program development, we're very intentional in our work, and much like Rani talked about, we do that based off learning, what's in the community through current grantees, through research articles, and what's happening at a national level. We do these large multi-year programs that include, evaluations for our work. We also are very engaged with the community in smaller grant making and in responsive grant making, to make sure that we can have relationships and provide support to grantees, organizations at all different levels and all different sizes. Community partnerships, very important to us, and we also recognize, our ability and the importance of convening, for conversations and for learning. But we're also very active in advocacy as well. Our major push is around healthcare access and utilization to make sure that all New Yorkers have and use their health insurance. Next slide, please. As I mentioned, as far as equity goes, we really center equity in all of our work to achieve our vision, and we've really made a strong commitment in understanding that it is a long-term effort, and it will take continuous learning and growing as a foundation. And so, we've really put our efforts in to what you see on the slide here, but again, engaging with, listening, and learning from experts in the community, not just experts in terms of our stakeholder partners, but the experts of those individuals who are in the community, who are leading and doing that work. We also prioritize proactive building of new relationships with grassroots organizations, focusing a lot on those who may have faced barriers to working with the philanthropic community that may have prohibited them to working with us and others in the past. And as I mentioned, using our platform to advocate for positive change. If you could advance the next slide. This looks like the Chutes and Ladders game that I remember as a kid, but I thought it'd be great to show you a visual, and not going to go through this, but we really feel strongly about our journey toward health equity and the importance of sharing that with others, with other funders, and the community, to really show and be transparent about the work that we've done, how we feel we're building momentum, but then looking ahead at the work that we need to continue to do. And if you see, there's a QR code at the bottom of the screen there if you'd like to scan to learn more. But again, this is not just the way we're working with organizations. It's also our internal processes and how we operationalize that throughout our foundation and the work that we do. So if you can advance to the next slide, please. We do operate off a theory of change. And as you see here, our vision I mentioned earlier, our long-term goals, we have 8 midterm goals that we focus on and a lot of strategies. So I thought it'd be helpful just to pull out, our theory of change that focuses on family caregivers. And as you see, our midterm goal of family caregivers of older adults are valued and supported. Really, our approach is building capacity for and expanding access to support for family caregivers. We do use, different tier approaches to the evaluations that we have for our different programs, but needs assessments are very important. Monitoring and accountability, utilizing the RBA, results-based accountability framework, for a lot of our work that we do. And then we have other more rigorous levels of evaluation as well. But a lot of our work is around that monitoring and accountability, as well as quality review and program clarification in our work. So if you could advance the next slide. We've done a lot of work in the past on family caregivers, really more as it pertained to older adults in that we served. This included, providing grant support for powerful tools for caregivers, as you know, as an evidence-based model to help caregivers. We did that throughout various Western New York counties. We also funded other projects, including a few different respite models, but this was when we were doing more general older adult work. We over the years have really developed an understanding of the needs that came for family caregivers, and that includes, the 2020 Caregiving in the USA report from AARP, Families Caring for an Aging America report, as well as the National Academies of Science report that we co-sponsored along with the Hartford Foundation. Our work really expanded rapidly, and with a partnership that we came into with the Ralph C. Wilson Jr. Foundation. For those of you who aren't familiar, Ralph Wilson was the founding owner of the Buffalo Bills, and upon his passing, a foundation was created to operate both in the Western New York and Central and Southeast Michigan areas. An endowment was provided to our foundation, which is how I came to our foundation, really to specifically focus on supporting and developing programs and initiatives to benefit family caregivers. And so in 2017, that really ramped up our work that we've done to support family caregivers. If you can advance the next slide. Work that we've done to address that goal, I mentioned the Families Caring for an Aging America report that we felt it was important to sponsor. That's led to a lot of other work and ways that we've looked at our how we can support family caregivers. We also supported a scan of caregiver support programs in our region, most notably memory cafes, which I'll speak about shortly here. We also, in 2014, when the Administration for Community Living, in conjunction with Arch National Respite, convened the expert panel on respite research to assess what's known about family caregiver programs. So we joined that consortium, and we did support a study on building evidence for respite. And then, like I said, we provided various grant supports to programs throughout our regions. Moving forward, if you could advance the slide, please. We're really looking at supporting initiatives that elevate and address the needs of family caregivers at the local, state, and national levels. This includes the Caregiver Nation that Rani mentioned earlier. We're a funder, we're a co-funder that includes New York State and their Caregiving and Respite Coalition, who have really been working to develop their advocacy muscle and messages to promote respite and caregiver support throughout New York State. We also are very active in the master plan for aging in New York State that has a heavy focus on family caregivers. And we're also really focusing on looking at ways to expand family caregiver respite and supports, particularly in diverse communities like the Latino communities here in the Western New York region, in our rural communities, and with faith leader groups. And if you could advance to the last, second to last slide here. Exhale was really highlighted yesterday by Linda Weiss from the New York Academy of Medicine, but that is one we wanted to highlight quickly. I know I'm running out of time here. The Exhale Respite Pilot Project was really brought on by all the research that we've learned about the need for serving caregivers in the community, the need for respite, and the need to build respite informed by caregivers. That spurred 3 different phases. One that started where we brought rural communities together to talk about family caregiver needs and utilizing a creative problem-solving process, where 3 very robust pilots were created. One being the West Falls Center for the Arts Musical Memories Cafe, which we're really happy that they are one of the innovative and exemplary respite programs recognized by Arch this year. That program and the Musical Memories Cafe really spurred us to do a scan around memory cafes and their viability in the Western New York region. That really led us to developing a new offshoot or a brand of the Exhale Respite program called the Western New York Memory Cafe Collective. We currently have 11 different programs, memory cafe programs, that are being developed in the Western New York region, working with arts and cultural organizations throughout the greater Buffalo and Western New York area, that we believe are going to lead to even more robust evaluation on not only the caregiver respite program, but this memory cafe model. And if you could advance to the last slide. What I hope to be able to do here is just really explain and build off what Rani said, just about how our foundation and the work that we do in working at the national, state, and particularly local and grassroots levels is rooted in equity, but how important equitable research and research is in helping us really inform how we do that work, and just how important it is for us, as Rani said, to bring it into the neighborhood and local levels, and then work as hard as we can with our community partners to bring robust and valuable evaluation and data that can help inform further research on your end. So thank you for your time.
Thank you so much, Ken. That was incredible. Again, thank you to both of our speakers for sharing. I am impressed by the deep commitment to equity and system change and partnership and advocacy. I think that is so important in all of our work, but to see that from funding agencies is incredible. So just appreciate the work that you're doing. We are a little bit over, but I do want to give us about 5 minutes for questions, and we will adjust the break time accordingly. So if anyone has questions they want to ask live, feel free to raise your hand and we'll let you unmute, or feel free to post questions in the chat. While we're waiting for any additional questions, I just want to ask, with that deep commitment, I know that takes extra work, right? And it takes extra time. And I'm wondering how, as an organization, what is the motivation to allocate and support that extra time to do that deep engagement and partnership? Because it's easier to not do it, right? And so just curious if you've run into any challenges with that, or have any words of advice, or other organizations that are trying to really do that deep engagement in equity work.
You want to start, Ken, or you want me to?
Go ahead, Rani.
Well, I just think that if you're looking at our society, and again, we fund nationally, right? So there are a whole patchwork of beautiful, different kinds of communities across this great big country. You just have to see the mandate. If you really want to do what's best for people where they are, to age in place, to be in community, it wouldn't be right to ignore the fact that there are differences and that these differences are meaningful not only on a personal level, but quite frankly, to people's health, to their quality of lives. And so we started on this journey, and it is a journey because you're never going to be all the way there, I think. Most of us are just going to keep trying. But we started on this journey well before COVID hit. But if you didn't know it before, watching things unfold during the COVID period and who was hit the hardest, and understanding what that, to the best of our ability, what that means in some communities that are harder hit than others, we just doubled down on the efforts that were already underway. And I agree with you that it takes time and it takes intentionality. That's really hard when you're moving fast and trying so hard to field build, and that's important too. But we wouldn't be doing it right if we didn't put some focused attention on that.
Thanks, Rani. I agree. The pandemic definitely put a microscope on the inequities and elevated the awareness of those that were always there. But yeah, Ken, go ahead.
No, I was just gonna say, I mean, I agree with Rani, but I will say, Kim, I mean, it does take a commitment, and I think it takes intentionality, and we certainly see the importance of making sure that we are in the community, but it does take time, and we call, I mean, I don't know, we heard the term like beyond the check sort of work, like that's to us, it's super important, to make sure that we are out in the community doing that. But I think we've also recognized that we can't be out in the community as much as we would like to as well. Like Rani, we have a small staff. I mean, our program team is there's 5 of us, but we have 16 counties and a lot of treading our tires to get around. We try to figure out other ways that we can help communicate and encourage our potential partners to work with us, and that included us looking at our application process and the application when we for organizations that that reach out to us to make sure that we can have a more equitable and inviting way to encourage organizations to work with, because that's the one thing that we do recognize is there is a power imbalance with funders and partners at times, and I think it's really on us to figure out what ways can we break down those barriers, and then also working with, and I think this is one thing that is really something we think about as well, is we are a foundation that looks to put money into the community, and so as Rani said, like we do have time constraints, we do have deadlines, but we also recognize it's important to be relational in our we develop relationships and not do it in just a transactional way, so to speak, because I think when we're looking to work with community partners, if you're walking in with the thought that we'd like to work with you, we want to give you money, you're not really developing intentional relationships. You're not really learning what individuals' needs are. And when it was talked about earlier about how people define caregiving and respite, that's just so true to us, but in so many other of our areas of work that we're doing, including addressing and looking to address firearm violence prevention in our community right now, we recognize how important it is to develop real good relationships and be humble when you go into that work, because we're not the experts. So work needs to be done on our end to make sure that we can have trusted, bi-directional relationships with our partners.
Thanks so much for that, Ken. I wrote so many notes about things you said, making that funding application process accessible to people. I often find that it's the small grassroots efforts that can do the most with the littlest amount of money, but they don't often have the academic training background, time to put in the work that we create barriers around in applying. And you mentioned too that that real commitment, and we often talk about making sure that It's not that checkbox, right, Kat? It's not like, oh, yeah, we talked about equity, we focused on diversity, check, check, check. I like to think of it, and a lot of other people talk about it as it's not the frosting on the cake, but it needs to be baked in to the cake, right? Like this needs to be something that can't be missed. It has to be part of the structure of what you do, and that does take a lot of intentionality. And it's great to see two exemplar organizations that are doing that, and I thank you both again for your work. We are out of time, though. Again, we could talk for hours. If others have questions, please continue to put them in the chat. We're going to go ahead and I'm going to give us a 10-minute break. So we're going to start just 5 minutes past what the agenda says, but I want to make sure we have adequate time for a break. Marcia, if you could just pull up the slides. We do have a break question for you. So in addition to taking some of your own self-care time during this break, think about what might be an accomplishment you've had in conducting respite research with racially and ethnic diverse communities that you want to share with us. We'd love to hear about the great things you have been able to do. So if that's relevant to you, please post that in the chat. And we'll take a 10-minute break instead of a 15-minute break here, and we'll see you back at 2:50 p.m. Eastern time. So thanks again to our presenters, and you won't want to miss the second half of the summit. So we'll see you all soon.